Today we will see this unusual presentation of a choroidal melanoma, and this is a elderly gentleman aged 59 years who had undergone cataract surgery few years back and has also undergone trabeculectomy, and presently the intraocular pressures were controlled without any topical medications. There was no other systemic contributory disease, and a special mention is about diabetes mellitus here. So patient was not suffering from any other systemic disease which could be contributed to this present illness. The patient had complained of diminution of vision in left eye for last 1 year, and for this patient had received 3 intravitreal injections over a period of 6 months, and patient gave history that there was initial improvement after the injections, but the complaint or the diminution of vision, it recurred few months after the injections. So it was some kind of refractory macular edema, as we can contemplate from this particular complaint. On evaluation, the fundus of the left eye showed some kind of hard exudates at the fovea and macula. Along with that, there was this pigmented lesion inferior to the macula, and it was subretinal, as you can see that retinal blood vessels traveling across over it. And this is the composite montage image showing the rest of the retina, which is very much normal. And incidentally, we can also notice that there is hardly any glaucomatous damage to the disc, but in any case, trabeculectomy had been done, so we don't know whether the patient had any damage earlier or was having raised IOP in the past or not. However, this was the present situation regarding the macular disease. So here we can see it in focus that the macular edema in form of evident as a hard exudate and OCT and the pigmented lesion, and a OCT was ordered. This is the right eye and this is the left eye, and we can appreciate that the left eye temporal part of the macula is having cystoid spaces and fluid filled space in the outer nuclear layer. However, the retinal pigment epithelium in this particular cross section is absolutely fine. The cystic space and the fluid in the outer nuclear layer. FFF was ordered, and we can see it also demonstrates microaneurysm and leakage at the capillary level with no NV, and this is the area where the choroidal melanoma or the suspected pigmented lesion in the choroid was there, and this also shows no any activity. So suspecting a choroidal melanoma, oncologist opinion was sought, and oncologist ordered a PET CT scan whole body, which came out to be normal. So then there was no evidence of any systemic spread of this particular issue. So now the diagnosis was choroidal melanoma with macular edema in the left eye and pseudophakia in both the eyes, which was post-trabeculectomy with controlled IOP without any medications. There was no systemic involvement or metastasis as seen on PET CT scan. So the management plan was decided, and this was intravitreal anti-VEGF to resolve macular edema in the left eye, followed by laser photocoagulation to the melanoma in the left eye. And we expected that once anti-VEGF has taken care of the edema, delivering the laser would be safe and will not aggravate the macular edema. And later on, when this lesion is treated, the problem of macular edema, which was recurring, will resolve. And this is the photograph post 1 month anti-VEGF injection and the OCT after a month of the injection, and we can see the macular edema has resolved and the retinal thickness have come down to the nearly normal levels, although there is still some space in the outer nuclear layer. So once the macular edema was resolved, laser photocoagulation was done, and this is the montage image showing the lesion which has been photocoagulated, which can show variable pigmented appearance, and this is a sign of destruction of the tumor or the lesion by the photocoagulation process. And in the follow-up period since March 2023 till this September, the patient is doing fine. There is no recurrence of macular edema, and I think the patient has been treated with this disease. Thank you.